Hello, everyone, and welcome to Find Out My Breast Density Day 2023. I am Amy Malinowski, the social media outreach coordinator at My Density Matters organization. Thank you so much for joining us. We're really looking forward to focusing on a campaign we launched last fall. It's called Check Your Chart. Check Your Chart's an education to action initiative inspiring women to obtain their mammogram report from their online patient portal. They can learn about their breast density and communicate with their doctors to collaborate on additional breast cancer screening if they have dense breasts. We began this campaign because we wanted women to learn their breast density so they can be empowered to advocate for themselves for additional screening if they find they do have dense breasts. Personal health information like medical visits, test results, that is all in your online patient portal, along with a messaging system, allowing you to send your doctor messages and questions about your health and possibly your breast density. So we are so lucky to have a special guest joining us today to educate us more about breast density and the importance of checking your chart. I have the pleasure of introducing Dr. Kirti Kulkarni, MD. She is a breast radiologist and associate professor of radiology at the University of Chicago. She also serves as vice chair for communications and director of the Breast Imaging Fellowship Program at the University of Chicago. She is board certified in diagnostic radiology and fellowship trained in breast and abdominal imaging. We are so grateful to have you here today. Hi, doctor. Thank you so much for joining us. Can you just tell us a little bit about yourself? I know I did a quick intro, but anything else you'd like to add or?
Thank you, Amy, first of all, and to Leslie and her team for inviting me today on this platform. It is definitely an honor to be talking to the group and to having an outreach with multiple women out there and even the men about understanding what it is about breast density and more. My name again, like you said, Kirti Kulkarni. I am an associate professor of radiology. I am specifically trained in breast imaging. So the fellowship was a 1-year fellowship at the University of Chicago, and I stayed on as an attending. In my day-to-day practice, I read screening mammograms. I perform diagnostic clinic. That's the time when I get to talk to the patients. I also perform breast biopsies, and a big chunk of my time I do teach our fellows and residents that rotate at the university.
Really, thank you. Thank you so much again for meeting with us. I think a great way to start, if you could maybe give a little background on what breast density is, just talk a little bit about that.
Absolutely. So breast density is not something that I would know unless I get a mammogram. A lot of people think that I could palpate my breast or feel the breast and understand what my breast density is. Some people think when they go to the doctor can do physical exam and let me know the breast density, but that is not true. A mammogram is the only way one can definitively say what the breast density is. Breast density is essentially a ratio of glandular tissue versus the fat in the breast. Breast is made up of glandular tissue, fat, fibrous tissue that holds all of it together, and then ducts that go towards the nipple. There are multiple ducts. And this ratio between the fat and glandular tissue determines the breast density. There are 4 types of breast densities: A, B, C, and D. Very simple. A means it's very fatty, which means that less than 25% of glandular tissue is seen on the mammogram. And B is when it's up to 50%. C is when it's up to 75%. And D category, which is extremely dense, means that there is more than 75% of glandular tissue that is seen on the mammogram as compared to fat. Glandular tissue is white on mammogram and fat is dark or black on an X-ray. Mammogram essentially is an X-ray of the breast, but it is a very soft X-ray. Very low amount of radiation is used because this is not a bone, it's a soft tissue. And on this X-ray, we can determine, the breast density, especially if it's category C or D, means there is more than 50% or 75% of glandular tissue. It looks a lot whiter than the background, which is black, which is the fat. And cancer could be spiculated, like star-shaped or round or oval, and is also white. And sometimes it's difficult for us radiologists to differentiate what is cancer, is it hiding behind that dense tissue? And that's why whenever it is category C or D breast density, we really want the patients to know about it, number one, make them aware of that breast density, and suggest alternate screening or supplemental screening alternatives for this.
Oh, that completely makes sense. That kind of goes into my next question. And you kind of touched on this. Why is it important for people to know their breast density? So if someone is a CRD, like why is that important to know?
Absolutely. I think once a patient knows, first of all, it is now imperative, or definitely imperative for each physician to have this conversation with the patient about their breast density. It is in the report. We radiologists, our first line of the report talks about the breast density. And the denser the breast, that means, number one, it is difficult for the radiologists to find the cancer. Maybe mammography is not enough in those patients. And secondly, because you have more glandular tissue, it also increases the risk of developing breast cancer a little bit.
Okay. So basically, like there's the different categories of the breast density. Those with higher breast density are at a higher risk of developing breast cancer. And it's also harder to see the cancer on the mammogram.
Correct.
Touched on this a little bit too, how someone would find out their breast density. It is not something they can find on their own, correct?
Absolutely. I get that all the time when patients come to their clinic and the first thing, I've always been told I have lumpy breast, and I look at the mammogram and I literally make them sit down and watch the different densities, like a little, I have a example picture in my office so that they can get to know the difference. And I showed their breast density and explained to them that you are category B or A. This was wrong information. And as one ages, the density changes over time, right? So you might be born with breast density of C, and as you get perimenopausal, you still might be C, and then postmenopausal, you might go down breast density, which could be a B, because after menopause, these glandular tissues, they become what we use the word atrophic, means they shrink a little bit, and so breast density can change in the postmenopausal age. Or if someone is using hormone replacement therapy, or it might start as a B, but if someone is using hormones for some other reasons, it might move to category C. And then we wonder, why would density change? And then we look into the patient's history to get some additional information.
Okay. Yeah, that's really interesting. And the only way to find that out is through a mammogram.
That is correct.
Very good. And once the mammogram is done and the testing is complete, how do we find out what our density is afterwards? Like, do you know, like when we're checking our chart, are there any keywords or phrases we should look for? And like what we should be looking for in our mammogram report when we do get that?
Sure. So if you get a screening mammogram, typically you leave the mammography suite after the mammogram, and you might not get a chance to talk to a doctor. You will get a letter in mail, and in my chart, a report will be posted that says the first line of the report, which says findings, and under findings, it will be mentioned that the breast density is, and then typically we mention the alphabet and what it means. A being fatty, replaced, B is scattered fibroglandular densities, C is heterogeneously dense, and D is extremely dense. That's where you will find in the report. And we usually send a letter in mail, and the letter also states that at University of Chicago, so and so you had your screening mammogram. We noticed that your breast density is whatever the breast density is. So this is the template that is followed by the American College of Radiology template that is followed by almost all of the accredited institutions.
Oh, that's great to know. Yeah.
So we do send that letter which explains the breast density. I also in my report make it very clear, if the category is C or D, that there should be adjunct screening.
Okay, great. So really the things to look for are the words like dense breasts or that A, B, C, or D, and any mention of like additional screening.
Yes.
If a woman or they do find out they do have dense breasts, and they see that from their chart, what should she do then? Can she contact her doctor about it, collaborate, follow up? What do you suggest is?
All great questions, Amy. As we're trying to educate our patients about this, it's important that they actively advocate for themselves and reach out to their doctors, whether it's primary care physician or OBGYN. But sometimes it's important that the patient actively reaches out and says, this is my breast density. It's mentioned I need adjunct screening. Can you put in that order for me so I can get that scheduled?
Absolutely. Yeah. I think like reaching out, advocating, these are all amazing points. I just want to say thank you so much for taking the time to talk to me and everyone about this. Like you were saying, sometimes when we get to our patient portal, it can be very overwhelming. So knowing exactly what to look for in our mammogram reports, words like density, the A, B, C, or D, additional screening, I think that's extremely helpful. To learn more in detail about Check Your Chart, you can text Check Your Chart to 211-411 or go to our website at mydensitymatters.org. Again, that's Check Your Chart to 211-411 or go to the website at mydensitymatters.org. Doctor, it has been such a pleasure talking with you. I just want to thank you so much for taking the time to talk to us today. I know you probably have an extremely busy schedule. Healthcare really can be so overwhelming a lot of the time, and you answering our questions and just putting everything into context so well has been so helpful, and we really appreciate it. Any last thoughts or information you'd like to share with the group?
Thank you, Amy, first of all, for this lovely conversation. And thank you to My Density Matter for, empowering women with this great information. Few last words as advocate for yourself. It's important that we educate ourselves with not just with breast screening. There are other things related to our health. It's important that we know, actively ask questions to the physicians and get answers, and check the charts for the test, because communication is such a strong way, an important route.
I think communicating is like the number one thing you can do and advocate for yourself. So again, thank you so much. This has been a wonderful conversation, and everyone have such a great day. Thank you.
Thank you.